how long do two clinical trials last?
So maybe I can start with that. And I think there's two aspects to that question. So for an individual patient, the length of therapy on a clinical trial will vary dramatically, again, depending on the phase of the clinical trial and the structure of the clinical trial. So some trials for newly diagnosed patients with leukemia, for example, may last 3 years, where patients are on treatment for that long on a clinical trial. Whereas others, like these new trials that we're talking about, really the length of time varies, and it depends on how the patient or the child is responding to the therapy. So for most of these trials, the patient can stay on the therapy for as long as they're benefiting, meaning their tumors are not growing or their cancer is not getting worse. And as long as they're not having side effects that are too severe, that means we would have to stop. And so it really varies depending on the patient and how they're doing. But like I said, it's dependent on the phase of the clinical trial. The actual whole clinical trial is a different question, and that clinical trial enrolls anywhere from a couple dozen to thousands of children, and that can last for many more years. But that's not what an individual patient experiences.